I have eyeballs. How exciting. You've been knocking. You're going to run out to reception at the back.
It's not finding it.
You want me on?
Then.
So two of my friends are with me.
Okay.
They're just going to film it. One's going to come on, so she's going to watch. Then it's the modernised one.
That's
Okay?
fine.
Thank you. Which one are we doing?
Doing one at the end first.
This one.
Yes.
Oh, we did one of them today.
Oh. I'm gonna come round to the screen on this one.
Yeah, so you can have a look. What,
Yeah.
Because this is the same one we did before surgery.
Yeah.
So, Sheen, what is this one? Sorry? Corneal topography? Yes.
I like how she's asking you the questions.
I don't want to say the wrong thing.
Is it topography? You think I didn't teach you properly? You're ashamed of you.
Oh, sorry.
That's alright. Am I in your way?
That's fine. We'll come down.
Just you wait.
Brilliant, you can rest back. Go and check your pressures now.
Which I'm still not good at.
I think you're good.
I hate doing pressures.
Brilliant, you can rest back.
So my steroids finished a whole week ago. So there might be steroid respondents. 'Cause that-
15 and 14.
Oh, that's good. Great. So work went up to 19 and 20. But 15 and 14 was pre-op pressures.
I see.
So it's gone back down. Lovely, thank you.
I just OCT.
This is the OCT. This is where you see the lens positioning now. So it's going to be, you see the iris, and then you see two sections of it.
Comfortable ones?
Yeah. Oh, a bit here.
Which are you able to see? Yeah.
So take a few blinks. Nice and wide now. Good. Few blinks again, and wide again. Take a few blinks, and wide again. Few blinks again, and wide. Couple of blinks, wide now. few blinks again, and wide now. Take a few blinks, and wide now. Blink as normal. Few blinks again, and wide now. Brilliant. All done. Get out of the bag. Brilliant. If you continue taking your seat, Mr. Holder.
Okay, so we've got nothing.
Yeah,
that's pretty
that's
much
nothing.
nothing. If anything, if that is genuinely there, I'll just not need reading glasses for an extra 2 years. That's a little bit of my
Make the most of it. Yeah.
preservation.
Let's have a look. This is looking okay. There's nothing there. That's good to be
So
on the
you'd know more than I would here.
You've just got flat corneas now, but you had flat corneas before.
Yeah, well, nothing's happened to my cornea. My
Yeah.
cornea is completely untouched. Okay, so this is what. This is where he's going to look at the vault of the lens,
Yes.
because this is the natural lens,
Yeah.
that's the implant, and I think this measurement is really important.
Yeah.
But I don't know what it should be in terms of the guidelines. So he needs to. So that one's obviously more.
Yes.
Yes, the left one's more. This is what we said on slit lamps. On
Yes.
slit lamp, we said the left one is vaulted more, and the
And the
right one
right.
is less. So
Can you look
795.
at the angle actually
597.
on the right eye? The right eye looked pretty good.
So that's the right eye.
That was open. The
The
left
left one.
eye was.
That's the right eye again.
That's the right eye again. The left eye, I thought.
42.62, and this was
Yeah.
34. Okay, so it's
Yeah.
oh that one 33. It's on
That
that
one
side.
looks so. Yeah, that one. It looked a little bit uneven. A
Okay.
little bit displaced on.
It's a difference between the
right,
two.
Yeah, on the right hand side.
That's left eye then.
Right.
Yeah.
We're going to worry about
Okay,
that.
so there's my-
Everything else is right.
Ah, lovely for Mia.
Yeah.
And then if you look at my old ones, if you look back, so here's my.
Oh, compare it to the air.
So this is, what is this day? This is 23rd. That's 2 days after. That's the aftercare. So 20th of May was my surgery. So that's the Monday after.
That's like 45 difference today.
Yeah.
I don't think we're going to panic about that. How
Yes,
much
it's-
vaulting is allowable?
Oh, I can't remember the dates. The numbers. He knows the numbers.
Right.
The main thing is there has to be enough space between the implant and the corneal endothelium,
Yes.
and the implant and the natural lens.
Yeah.
Corneal endothelium to keep your endothelium
Yeah.
count, and natural lens to prevent a cataract.
Well, to stop it touching. That was
Yeah.
the only bit I was worried about with you because you don't have that. Your eyes are not that
Big.
They're not that big.
Yeah.
Yeah.
But he was quite happy with the distances before.
Okay.
He was
That's
saying.
fine.
Okay, that's first. Okay, let's compare there. So this
Yeah.
is 23rd. Okay, so the left eye is 864.
Yeah.
And where's the right eye? There's a little mark on there. So the right eye is 668 and the left eye is 864. Okay, so
See,
then,
I think that's pretty good.
and go to today. How much is
it's
it?
come
today?
down. You're now on.
What is this now?
I mean, I'm presuming that
It does settle. Yeah,
yeah,
that's why we do the
that's
4
when
week
it's
follow up.
settled. Yeah.
One less.
See, that was the one I was a bit. I looked at that and thought, oh, that's a bit
22.
narrow. But
Here, so
Yeah.
the left eye
now,
795
which has come down.
and it was
865.
so it's sat
Yes,
back,
which is
which
what
is
you'd
not what we thought it was.
No,
though.
we thought it vaulted up.
We
more.
thought it came forward, and we thought the iris looked forward.
Okay.
So that's different opposite of what we thought.
And same again on this one.
So right eye, the gap is 5.9, and
And
we
it was 6 something before.
6. Yeah, so they've both settled.
Yeah.
He said that they would. He said
Interesting.
that they would settle, and we
Yeah.
are looking at the iris every day religiously, and we're like, oh, the iris looks a little bit forward.
Do you think it's because we're paying more attention to it and we've never paid
100%.
attention
No,
to it?
because you know what it
before?
is. When I get anyone else to look at my eyes, they're like, we can't even tell what you've had done. But when you look, because you've seen before, after, you've seen Sarah's, you've seen what it can look like.
I'm a bit more aware,
You're looking for it. You're looking for it.
So what does Zara's look like?
Sarah's came forward. Her iris came forward.
So the vaulting went down to...
The vault was too much.
The vault was too much.
The gap between the natural lens and the gap between the natural lens and the implant was too big, and the iris got a little bit touch.
Okay.
So we just changed it over.
So has he taken it out?
He's taken it out.
Yeah.
Put 2 new ones in.
Oh, gone back in again?
Yeah, 2 new ones straight away. 1 out, 1 in.
Uh-huh. This looks okay. These angles are fine. They were a bit different in the 2 eyes, but not too worried about that.
But my left eye is it's
That was the one that's...
my pre surgery. That was me.
Yeah. Horrible.
Horrible prescription.
Horrible.
That was me before. And then if you look, I was like 6'6" minusy.
Yeah.
But to the point the other optometrist thought I was amblyopic, and I was like, no, amblyopic. But yeah, that's me.
Yeah. I have a filming tonight. Wait for the IPL, not for the ICL.
Okay.
But this is not for patient, for professional. The company want to tell professional. Yeah. Okay. Right. Can you see that?
Yes, that's
Of course. How
Okay,
about those?
2 eyes. It's the LCNK.
He's trying to show off now, being
Okay.
fast. Okay. No.
If you want to stop, so D N Z
The
L
bottom.
E F P H.
No.
Okay, I can see the VFLN, but I know it. The bottom, I can see the H, I can see the R, I can see the K, and I can see the C.
I can't have any more letters.
So I can see that.
We
But
see
I know it, but I can see it.
Let's compare the two just to
Okay.
for fullness. Yeah.
Okay, so VFLN definitely, the H yes, the
Mhm.
R I wouldn't be able to see, KC maybe,
Mhm.
but the H you can see.
Okay. And the other one?
VFLN definitely, the H I can, the R I can, the K I can, the C I can.
How amazing is that?
And I've never been
Can
that.
I mention that?
I've never been that.
Pre-op, you've been 6'7.5" in the right eye
Yeah.
and 6'6" part in the left.
Yeah, I've never been
And now
better
you are
than 6'6".
6'5" part in the right and 6'5" part
Yeah.
in the left. So
Yeah.
you are improved 2 lines at least in the right.
And
Yeah.
to be completely honest with you, it gave me a headache by seeing so much. I couldn't
Probably
deal with
right.
it. For the first week, I was like, I'm overstimulated. I couldn't switch off at night. I couldn't go to bed. I went to bed with, as if I was still running. I had to take my glasses off to just defocus. Yeah, it was too much. It was a lot.
Yeah.
But
Amazing. That's how ICL sometimes increase your potential of vision.
yeah, it did.
So
Because
like you could not ever break that barrier of 6'6". Now
No.
you are 6'5".
I think it's astigmatism because
Mm.
with contact lenses there was always rotation. With glasses there was always the magnification blur and the edging was always a bit off.
And correction inside the eye.
Yeah,
So
I've never had.
So the aberration is less with the
Yeah.
implant.
There's no aberration. There's no nighttime halos and there's no glare.
Perfect. Good.
I did a long drive at night, pitch black, in the country lanes, and I did nighttime driving in the rain. Nothing.
You tested all.
I did everything. Oh, I tested it. Really. I was laughing. I tested that.
Fantastic. Okay, let me have a look now. Good. It's all clean?
Yep.
Pressure was 14. That's normal
pressure.
pressure.
There is change on the iris positioning. We've been watching it every day.
Okay.
So we have been watching it, and we do think there's a bit of change in iris positioning compared to left and right. So you can tell us if we're right. So my manager at work, David, he said that the left iris is a little bit more forward, and the right iris is a little bit further back. So the gap between the implant and the natural lens is more in the right and less in the left.
The gap between the lens and the implant, and the cornea and the lens, you mean?
No. So the gap between the implant and the lens is
It looks like the opposite
more,
to me. More on the
yeah.
left, not on the right.
more on the left, yes.
Yeah.
Because the left implant is more forward
That's right.
and the right
yeah.
implant's more back.
That looks like it.
Yeah.
We can measure it as well. You just look at the eyes. You know the PIs.
Yeah. And there's so many people that can't find them. They're
No.
so delicate, they're so
Look, there's
fine.
1, two, then
Yeah.
they're both updated.
I can see them in the mirror now because I know where they are.
You know what she does in her spare time now.
Oh, yeah, no. They're both good here as well. Perfect. I mean, your pressure is perfect, normal. Good.
So is it within the
back of the arm?
is it within the safety measures of the positioning?
Yeah.
Yeah.
Miss Ahmad, do you want me to turn the lights off?
That'd be very good, actually. I don't offer that for normal patients. Unless someone knows us.
Who am I normal?
I understand. None of the bitches. That's good. Right, so if I measure the volt here, but we did the OCT obviously for that.
Yeah. So we looked at the OCT scans, but we didn't know what the measurements should have been.
So this one. So let's look at these pictures. Thank you. Oh, thank you. Oh, I switch off. So you. So this is the OCT, right?
So that's the right one.
This is the right, that's the left. So David was right
Yeah.
with his observation, but normally we compare with the cornea thickness.
Okay.
That's the best way.
Yeah.
So you cornea like 500 micron.
Yeah.
So you say, okay, this is 1 CCT, 1.5, etc. This is your right eye, and this is the cross section, obviously.
Okay.
This is your iris at the edge here,
Yep.
and this is a lens, and this is your natural lens. This is the implant, I mean, and the natural lens. So that's vertical line distance from the highest point between your natural lens and the implant. 597 micron. That's 1.2 CCT, or 1.1 actually, right? So this one is
More.
7. You're right, so more. Now that space should be ideally between 250 to 1000.
Oh, okay.
If it's more than 1000, too steep.
Yeah.
Less than 250, too shallow.
Okay.
Doesn't mean that you change the lens. No,
Yeah.
it means just you observe more frequently, right?
Yeah.
This is perfect. The latest search, actually, the latest studies showed actually more voltage better than less voltage,
Okay.
because just protect the lens more because you
That
have the
natural
space.
lens, yeah. But this
And
still is
in your case, because you don't have that hole in the lens, so
Yeah.
the circulation around the lens is still limited. So bigger volt is slightly better.
better.
Mm.
And
So
it's,
in fact, in both, I know this looks like more push forward,
Yeah.
but actually this healthier.
healthier. But it's not close enough to damage the endothelium.
No.
So my endothelial cell count's
The
not
endothelium
protected.
always monitor and control. And we do this to measure the angle.
Yeah.
I mean, that measure is not really accurate because you see where he put the arrows,
Yeah.
this is all wrong. This
Mhm.
is, he
So
should
it's
done-
actually here, isn't it?
exactly,
There.
yeah, and
It's
should
there.
move there. And actually what they do, they drive a triangle,
Yeah.
and then there is a special mathematical do it. So this is not accurate, but this give us rough estimate.
Okay. And you're happy with my
I'm
angles?
happy with that one.
Okay.
So that is all good. Is this
So
today as
angles
well?
on both, yeah,
You
that's
want
they
today
did that
the
one today, yeah.
macula?
They did the
That's good.
macula.
Perfect.
So you're happy with my angles on both eyes on both sides?
Very happy. Don't worry, the pressure is more important. Your angle is always narrower than the standard angle, you know that, because of the prescription, yeah. But as long as the pressure fine, the angle is open, as you can see, whatever you want.
Okay.
Good, you're doing really well.
Yeah?
I'm very happy with that.
Okay.
And to be honest, once you practice, nothing's going to change now. Things are pretty stable.
So I'm back to normal
You're
completely
back to
now?
normal now. How many weeks now, or months?
20th of May we got it done.
Yeah. 20th of May. So June, July. So we are month and month a week.
Yeah.
5 weeks.
Yes, it's been a week since
Really
the
good.
steroid stops.
Good. And we finished everything now. Cool. Back life to normal. There's nothing need to worry much about it except that try to be careful not to
Yeah,
rub
I
your
don't know.
eyes accidentally.
I
Yeah,
don't
so
know.
be careful. If they're itchy, we can give you antihistamine drops, not a big deal. But everything you want to do, you can do. I don't need to do boxing, we discussed that in advance. And no fights.
No.
Yeah, but honestly, doing really well.
Okay.
So nothing you need to worry about. The monitoring will be the usual.
Yep.
I mean, normally once a year, but for you, I'll see in 6 months' time.
Okay.
Again, because you have you're long-sighted,
Yes.
so just extra cautious.
Because of the lack of the hole.
Yes, yeah. I mean, if they patent, there's no reason to be closed. That's it. The tissue is scarred and the hole remain as it is. And this is treatment for used to be for glaucoma.
Yeah.
Still the
Yeah.
eye glaucoma, and patients have it once in life and they live.
And they're done.
That's it.
Yeah.
So
I'm happy that I got PI done because
it's good actually. Yeah.
it's quite nice to just have it done and just not think
Extra
about
one.
pressures and
Yeah. With long-sighted high prescription,
Yeah.
but you don't have also.
because my
shallow
grandma
IC.
has glaucoma as well.
Yeah.
So all my siblings went, oh, should I just get it done as well?
Yeah, why
Just get it
why
done
they
as
do
well.
it?
Just get it PI done, why not?
Yeah. Good. So I'm happy with everything. It's
Okay.
really it's nice and stable, and you have no issues.
So do I do the corneal endothelial count every 6 months then?
Every 6 months.
Okay.
Yeah. I mean every year, but let's do every 6
Yeah,
months.
so we'll see
There's
you in
nothing
6
to lose, to
months.
be
Just
honest.
do
Yeah.
do the corneal endothelium. Perfect. Can Roisin have a look? Can she use the flip now?
Yeah. Come. Please.
Can you show her what you did? All done. Finished.
How does it feel?
Best decision ever. Glad I did it. Shouldn't have done it earlier because I researched it. It was the right timing, it was the right person, it was the right decision, and now it's done.
Is he happy?
Yes, I'm happy with it. I'm happy with the results. I'm happy I did it, and it's just done. Like, I feel I built it up enough to have done it safely. So I knew I was safe doing it. And I hated the aftercare. I still stand by that. I hated the aftercare. I hated the drops. Hated the taste of the drops. Hated going to sleep with the shields on. But I genuinely enjoyed the surgery. So I genuinely enjoyed the actual process. The actual surgery was amazing. He was amazing. It was calm. It was gentle. The vision was amazing. The vision is still amazing. It's almost too good, to the point that it gives me a little bit of a headache because I can see clearer than I've ever seen. So I can see 2 lines better than what I'm used to, and it's getting used to that. And nighttime driving is amazing. No nighttime glares, no halos, just complete HD vision all the
So
time.
next appointment's in December.
6 months, yes. He's going to do a 6 month follow up, just because I'm a high profit prescription, so I was at more risk, and to keep my pressures in check, which I'll do at work as well, and my endothelium in check, which we'll do in December.
Amazing.
That's it.